Thank you everyone for being here. I know that this is the last one and you're ready to get on your flights and go home, so I appreciate you being here today. My name is Vicki Mackie. I am the founder and executive director of a nonprofit called Sights and Insights. For those of you who are not familiar with Sights and Insights, we are a 501c3 nonprofit, and we provide programs that have proven to help heal the emotional trauma that actually comes along with the cancer diagnosis. And we do that for cancer patients, survivors, caregivers, and also the clinical caregivers. I am a cancer survivor myself. I am also a caregiver. And as noted, I am the founder and executive director of Sights and Insights. But let me explain to you why. You see, I was diagnosed with stage 3 metastatic breast cancer. And when I finished with all of the treatments and the surgeries, they said, well, let's just give you one more scan just to make sure everything's okay. At which point, that's when they came back and said, it's metastasized in both of your lungs. So my first visit to my new lung oncologist, I walked in and he had a form on the corner of his desk and it was all filled out. And he said, can we have your body for research? That was kind of my feeling that what my prognosis was at that point in time. Oh, and by the way, that was 16 years ago. And I don't know, every once in a while I think about that, and maybe some of you have the answer to this. Is there an expiration date on those forms, or are they still looking for my body? I'm not exactly sure. But if you know that answer, you can tell me later. Every once in a while, I have to wonder about that. So I started wondering, was there something that I did that was different? Something that helped me get through it? Because, you know, after a long career in the corporate world, in management, I found myself, after all of that, coincidentally working in a cancer clinic as their program coordinator. And a couple of things occurred to me. Number one, when I would go into the infusion waiting room and I would start talking to cancer patients, when they found out that I was a cancer survivor myself, it seemed like the language changed, and what I call today the cancer language. And they would start telling me things they were not telling their care team. And I would ask them why, and they'd say, oh, well, that's because, you know, it has nothing to do with the treatments and whatever, and I didn't agree, but what could I say? The other thing that was absolutely perplexing to me was every once in a while, and you're going to know exactly what I'm talking about, I would meet someone who had stage 1 whatever cancer, treatable, and they would be gone in 6 months. Well, with my prognosis, I wondered what was going on here. And did I do something different? What did I do that might have been different? The only thing that I could come up with is that when I was working in the corporate world, I always had a side business going of art and as a professional photographer. And then when I was going through all of the treatments and the surgeries and the recovery, I found that I was going back into my art to help me focus and stay right here. And I wondered if that had anything to do with it. Well, I became passionate about researching, reading all the studies on everything that I could find in art and in of itself, if it had anything to do with it at all. Well, that passion turned to, I think, to be honest, I think it was an obsession. I just couldn't stop. Went back to school. And when I came back, I went to the director and I asked him if I could put on some workshops. I had devised a curriculum that I just wanted to try out. And he said, sure, after work you can do that. So I did. Now found a couple of things with that. First of all, every time I put out a flyer for the workshop, I had a several-month waiting list to get into these workshops. The other thing was that I was actually keeping data because I needed to know if any of this was helping anyone. And I would have them fill out evaluations and surveys, and I went through all of this, and I was astonished at the outcome data that I was receiving, and people telling me how it had helped them with their emotional and mental well-being. So, what else could I do? I quit my job and took a running leap off of that proverbial cliff and started flapping my wings and started Sights and Insights as a nonprofit. And during that, I am still out there, by the way, I am still flapping my wings. So how is that relevant? One of the things that I discovered in all of the research and listening to people is that there is a difference between sympathy and empathy, and how that works with the way that you treat your patients, whether it's with sympathy or empathy. One is not better or worse than the other. They're very equal, but they are different. It just depends upon your particular experiences in life, how you treat your patients. And at the same time, that difference can also affect your health, I discovered. Empathy can affect your health, which we're going to be talking about. So rather than me stand up here and explain to you the difference between sympathy and empathy, I'm going to let the professional do that, Dr. Brene Brown, with her video. I hope you enjoy it.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
I hope you enjoyed that. I can't watch that enough times. It still makes me tickle every time I take a look at that. But sympathy and empathy can make a huge difference in the way you treat others, but also it can impact your health. Now, there are actually 7 categories of caregiving out there, but today I'm just going to focus on 3. Clinical caregiver, caregiver for a loved one, or what I call double duty, and what I call the sandwich caregiver. The clinical caregiver is what I call all of you, anybody who's in the profession of taking care of someone else. Nurse navigators, nurses, doctors, social workers, whatever it is, if you're taking care of somebody else in a profession, you are what I consider a clinical caregiver. The next one is the double duty caregiver. Now, this is hypothetically, as a clinical caregiver, and let's say that you finish work and you go home and you take care of someone else. Now, that could just be your kids, that could be your family, that could be a dear friend, it could be your parents, it could be whatever. If you're doing that, what I call the double duty caregiving. And then the third one is the sandwich caregiver. And no, I'm not really talking about making a sandwich or eating a sandwich as you are taking care of someone. What I'm talking about is feeling like you're kind of sandwiched in between. You're going home, and hypothetically, you are taking care of kids, as an example. And in another location, you're also taking care of someone else. And that could be your parents, it could be your grandparents, it could be a dear friend, it can be anyone. But you feel like you're sandwiched in between. I too was a sandwich caregiver, by the way. Now, the signs of trouble. And here's the thing that you really need to pay attention to. The signs of trouble. What do we tell people? What is key here? The key is early detection, because compassion fatigue is a huge hurdle out there. And I know that each and every one of you are very much aware of it, maybe going through it right now, or you know somebody who has. And also burnout. Now, burnout can be the consequence of compassion fatigue, but also burnout can stand alone because of the many hours that you put in on a daily basis. It can just stand alone, but compassion fatigue is a huge one. And you might also have heard the words vicarious traumatization or secondary traumatization. The symptoms there are very similar to compassion fatigue, but I'm going to mostly focus on that because I think that most people know about today, about compassion fatigue. There used to be, they would always kind of go, oh no, there's something now. It wasn't actually until the 1950s that they came up with that because of the nurses. But here's the signs of trouble that you need to pay attention and not just sweep under the rug here, which we have a problem doing. And that is avoidance, or you just really don't want to go to work and you don't want to take care of the patients. So what does that mean? You're losing some of your empathy there. Addiction and substance abuse is another one. And frequent use of sick days. There goes your PTO time. And detachment. And what I mean by this is it can be so simple that you just don't even pay any attention to. Someone at work comes up to you and says, hey, let's go grab a drink after work. And you go, oh, no, I should really get home, when the fact is you could have done that. But you find yourself just kind of distancing yourself. A sign you need to pay attention to. Early detection is key. You're going to hear me say that. And decreased intimacy, and that can be physical, mental, or emotional. And some of the physical signs, tense, agitated, or feeling on edge. And sleep deprivation, that you're going to find all through on all of these, because sleep deprivation is huge. And they're finding more and more research on how it impacts us today. So this is huge. Pay attention. And the signs of trouble for the double duty or caring for a loved one, the fatigue. And this is where, you're working hard. I know that some of you are near or have been in burnout, but you go to work and you maybe work half a day and you come home and you find yourself going to sleep at 5 p.m. And anger and resentment, and out of this one I will say it's resentment, because it's one of those emotions that we talk a lot about insights and insights. It's one of those negative emotions that what do we do with that? Is we push it down. We push it down inside. Because after all, who are you going to say to, hey, I feel resentment because I have to go home and take care of my kids? Really? Are you going to say that? No, you're not. Instead, you're going to just keep your mouth shut. You're going to push that down, that resentment. Frustration comes right along with that, with negativity, self-isolation and withdrawal, much the same way as the clinical caregiver, depression, relationship conflict, again, nausea, dizziness, and headaches are some of the physical signs of this. And the loss of empathy and emotional energy, once again. The sandwich caregiver, negative reactions towards others, difficulty sleeping, the nightmares. If you are having reoccurring nightmares, pay attention. Pay attention to those reoccurring nightmares, and please get some help with that one. Confusion. And I'm not talking about going into the other room and going, why did I come here? I know that I came in here for something, but I just can't remember. And trust me, we all do that. Confusion that I'm talking about is more than that. Loss and trust of independence, and independence is here so strong because why not? You are sandwiched in between. You have no independence because you're always taking care of someone. The overwhelm, the helplessness, and the constant thinking, which we're going to talk more about too, and less efficient, productive at work. So, as I said earlier, I was a sandwich caregiver. I was a single mom, taking care of a preteen and a teenager. My career was having me travel quite a bit, and I was also taking care of my aging and ill parents. The sandwich caregiver. So now, tell me, how many of you out there consider yourself a sandwich caregiver? Raise your hands. Quite a few, actually. I'm not surprised, because that's what happens in today's. I give you a lot of empathy for what you're doing, but I will tell you this, it does get better, and there are tools to help you with this. Health impact, how does that impact your health? Well, let's start with first and foremost, it weakens your immune system. It diminishes your antibody, production against influenza and pneumonia. I cannot tell you how many cases of flu, and particularly pneumonia, that I had when I was a sandwich caregiver. And studies have shown chronic and acute stress can trigger a lethal T-cell response, which is in your immune system. And of course, it can cause all kinds of serious illnesses, such as cancer is one of them. But it can also cause things like allergies, or flare-up of your allergies, believe it or not. And the recovery for post-operative is longer and probably harder. And also, that's not listed on here, chronic illness is another one of those. Now, what do emotions have to do with the immune system? Well, a whole lot. I'm going to tell you right now that Sights and Insights, that's actually what we do, is we stuff and unstuff emotions. And I've stolen that from George Carlin in one of his comedic acts. It has nothing to do with what we do, but I've always liked that. And that's what I see us doing. We stuff down those negative emotions. And these are just some of the things that it can affect. But interestingly enough, there is one emotion out there that is the worst one on your immune system. Can you guess what that is? It's hatred. Hatred, they have found through research, almost diminishes your immune system. And I combine it with anger because to me they go together, hatred and anger. And what happens when you have that hatred and anger and it starts diminishing your immune system, believe it or not, research is there. what happens then is it not only hurts you physically, mentally, and emotionally, but also because it is such a strong emotion, it starts manifesting more anger and hate. Now, how does that work? Actually, it's a little thing about the size of my finger, and it's called the reticular activating system right back here, because what it does is once you have especially that kind of strong emotion, it will go out and it will find more anger and hate. And so what happens is it starts manifesting and going, you're just going to see more of it, because that's one of the duties of the reticular activating system in your brain does. So how does that affect your psychological and physical complications? Well, that's pretty easy. Stress, anxiety, the feeling of helplessness, the feeling of hopelessness, depression. It will bring all of these things down. Now, one of the interesting things that I found was that in our programs, I often will talk to everyone, and we do have cancer patients, we have the caregivers in at the same time most of the time. And sometimes I will point out to them, you know, you need to kind of pay attention to this, because the caregiver is actually experiencing more anxiety and stress than the patient. Well, the reaction that I get sometimes from the patients is like, I think you just put an arrow into my heart. What are you talking about? The look on their faces, until we start talking about it. And they start realizing just exactly what the difference is. You see, the research has shown that in depression for caregivers is 2 to 34% higher in the caregiver than it is in the patient. And as far as anxiety goes, it is anywhere from 11 to 16% higher in the caregiver than it is in the patient. And caregivers have the higher depression and anxiety than any patient. And between 40 and 76% of cancer caregivers reported clinically significant symptoms of, what do you think? Once again, insomnia. So one of the things that causes insomnia, or one of the many things I should say really that causes insomnia, is what I call the chattering brain. So now every one of us has a chattering brain. And the chattering brain is that incessant talking. Well, what about this? And did I pick up the bread? Or what are we going to do about that? Oh my goodness, what about this? And it just goes on and on and on and on and on, and it will drive you crazy. In fact, for some people, it leads to depression, anxiety, and stress. It can be extremely disruptive. However, there are ways to respond to that chattering brain. So what do you do about it? Well, quiet the mind with a concentrated focus. Quiet the mind with a concentrated focus. Now, what does that really mean? Well, fact is, it means something different to each and every one of you. You see, it can be anything from meditating to gluing airplane parts together, putting a picture puzzle together, walking. It can be just reading, whatever it is. Staying right here, right now is what we call it. And I tell people in our programs, if you take no other tools away from these programs, if you take this one tool, it will help you with everything, not just what you're doing, but everything in life. And it's what I call staying right here, right now. Sounds simple, doesn't it? It's not. You really, really, really have to practice. Because sounds simple, staying right here, right now, but what does that mean? What that means is, 1 second ago, it's gone. Toodaloo. Can't do anything about it. It's gone. The next second, well, I'm here to attest with all of my years of living, you do not know what's going to happen the next second. I promise you, you don't. Now, you may guess, and you may even be right at times, what the next second will bring. And if you want, you can even do the, well, what if that happens kind of a thing if you want to. I wouldn't advise it, but a lot of people do that. So if you think about it, the only reality here in life right now is right here, right now, this very, very second. That's real. Right here, right now. Is it easy? No. Does it take practice? Oh, you betcha it does. Staying right here, right now, especially when everything is chaotic and you just don't even, and the chattering brain comes along and it just kind of takes over. Staying right here, right now. You know, all of you sitting right here, right now today, I want you to think about it right this second, right this second. I hope you're comfortable. And here's the key. You're okay. You're okay right here, right now, this very second. And if you can remember that, when it gets difficult, I'm okay right here, right now. The other thing that I think is key and very, very important is gratitude. And there's research showing how gratitude does help. And I don't care how you do that. For some people, it is writing in a journal every day, your gratitude journal. For some people, it is at the end of the day, just writing down everything that you've been grateful for today, that happened today. Or in the morning when you wake up, take some Post-it notes and write down the things that you are grateful for and put them on your mirror to remind yourself as you're getting ready for work. And the other thing I would highly recommend is acceptance. Oh, that one sounds like easy. No, it's not. But think about it in these terms. When you accept something, especially things that, well, let's take the chattering brain as an example, because the chattering brain, because of all the information we keep feeding it on a single day, and it just keeps trying to figure it all out for us, accept it. And it will diminish it. And so many other things, because the difference between acceptance and fighting it, okay, so what happens when you fight something? It becomes stronger. It has more power. And acceptance is the one that actually gives you power, which is huge. And like we talk about in our programs a lot, cancer can blow that control thing right out the window. Oh, I thought I had my life under control until this happened or that happened. So you may not have control, but I will guarantee you, you do have power, and that's huge. Use it. Now, the clinical caregiver and how to take care of some of these things. Take time for yourself. So what do you do every day with your patients? What do you say to them? You say, take care of yourself. Listen to your body. It's okay if you have to take a nap during the afternoon. You know, eat the right foods, drink a lot of water, take care of yourself. So here's what I'm asking you to do. Get a mirror, put it right up in your face, and say the same things to yourself that you're saying every day to your patients. Take care of yourself. The other thing that I think is hugely important is communicate, communicate, communicate. How do you do that? Find someone. Find someone that you feel safe with. Find that person that there is no judgment, and you can start unstuffing all of this stuff, this resentment or whatever it is that's in there, that you can unstuff and you feel safe and communicate. And in fact, one of the best ways that I know is even find a buddy that you trade off. Okay, it's your turn now. I've unstuffed all this, it's your turn now. Or take days, I don't know, whatever works for you. But communicate. Do not let all of that stuff stay down here. Get it out. And by the way, it's okay to cry. A lot of people, when someone cries, what's your first instinct? Because it makes you feel bad that they're crying, so you want them to stop. Oh, yeah, and put your arm, whatever you need to do to make them stop crying, please don't. Let them cry. You cry. Because there are three different kinds of crying that our body does, and this one, for the emotions, it actually does release those toxins out of your body when you are crying. So cry away. It really is okay. And this last one on this one is give yourself credit. I know I give you a lot of credit because, you see, I have been the recipient of I don't care what you do, what your job is out there, I'll guarantee you at some point in time, I have been the recipient of what you do, and I can't thank you enough for that. Give yourself credit because you do make a difference, and it is huge. So again, thank you for what you do. Now, what to do about the negative health impact for the double duty caregiver? The first one is accept help. Well, I'm going to put a little twist on that for you. You are here today because you are passionate about caregiving, about caring for others. It's in your DNA. You are passionate about it. And so what happens when somebody comes to you and says, hey, I need some help. Can you assist me with this? And I know exactly what you do. Without even thinking about it, no matter what's going on in your life, what do? You say, oh, sure, I'll do that. Yeah, I can help you with that. Because it's in your DNA, you can't help yourself, I'm sorry. Now, conversely, let's say that you've got a very nice neighbor, and you're kind of complaining to her one day, and you say, oh man, I'm just overworked, and I haven't dusted my house in a month. It's just awful. And so a couple of days later, your neighbor comes over and she says, you know, I've been thinking about this. I'm going to come over and I'm going to dust your house for you. So what do you say? Oh my gosh, that is so kind. You're so sweet. I can't believe that you would even consider doing that. How wonderful. But no. Oh no, I've got it under control. No, I can do it. I can do it this weekend. I'm planning on doing it this weekend. I don't want you to, but thank you anyway, because you're not going to put yourself in that vulnerable position, are you? So here's what I'm going to ask you to do, is I'm going to ask you to switch that. So when somebody says to you and you already are feeling overwhelmed and they say, can you help me with this? What do you say? Okay, I want to hear the new word that comes out of your mouth. What do you say? No. The word is no. No. Okay, now this one, I know you're going to do better on this one. Okay, so your neighbor comes over and says, I'm going to dust your house for you. What's your new word now? Yes, thank you. That is marvelous. So, yes. So say yes and just switch those words. That's all you need to do is just switch those words and find a backup for yourself. And when I say a backup, I'm not talking about picking up Sally Sue from the school. I'm talking about find a backup person who will take care of what you need to take care of for several hours or even a day while you go spend that time taking care of yourself. And there again, you can use the buddy system on that one too. Find a backup and maybe switch off days, once a month even. I mean, that's doable. I know it is. Well, maybe. Okay. Find a backup for yourself. Now the sandwich caregiver. Giving and receiving. And the first one, though, on this one is set boundaries. Because this one, I will tell you, that's one of the big things that got me through the sandwich caregiver crisis. And that's set boundaries. And I mean, from your neighbors, your friends, your family, your coworkers, all around you. Set those boundaries. Set the boundaries up because it will really save you a lot. Now, One of the things that I found is that when I was going through the cancer and the surgeries and the treatment and recovery, my daughter was my caregiver. And one day she came up to the room and she had made a sandwich for me, and she started to hand me the sandwich, and I said, "Oh, honey, I'm so sorry, I just can't. Thank you so much, but I really can't." And she became a little miffed at me, and I thought, well, that's really strange. And then I looked into her eyes and I realized it had absolutely nothing to do with that sandwich. What it had to do with is that feeling, I am her mother, she loves me, and she'll take me to the doctor, she'll make me a sandwich, she'll do all of these things, but she can't do the one thing that she wants to do. And that is make me well, fix me. Because when it's your loved one, it takes on a whole brand new dynamic of caregiving. When it's your loved one, it changes everything. And I realized then how important it was to receive the gifts from the people who want to give to you, because they don't know what else to do, that feeling of helplessness, that feeling of hopelessness. And you know, the research is out there too about giving and receiving, and I'm off the top of my head, I'm sorry, I don't remember the exact percentage, but when they ask people, which would you rather do? Would you rather give or would you rather receive? It's somewhere between 85 and 92%, I believe it was, people said, oh, I want to give. No, not so much receive. Now, why is that? Well, let me explain to you why. Because you all know how that makes you feel to be givers. Makes you feel good inside, doesn't it? It also makes you feel like you've got some control. It also makes you feel like you've got some power. Now, what does it feel to be on the receiving end? Well, it makes you feel vulnerable. It makes you feel less than. It makes you feel like, wait a minute, it wasn't that long ago that I was the giver and now I'm the receiver. And it's not, it's a very awkward feeling, trust me. It doesn't feel good, that vulnerability as being the receiver. So think about it in the terms of how you would feel as that receiver. So here's what I would say to you is that when somebody is trying to give to you, is give them the gift of receiving, because let them feel good. Give to the giver the gift of receiving. Now, there are many tools out there that we use, Insights and Insights, but here's one that we really like to use, and that is laughing yoga. And I know that there's probably some of you who are actually doing it, some of you who are maybe certified in it. And again, there's science behind that. Dr. Katari in Mumbai, India, in 1995 started doing the research. And you can see up here all of the many benefits that he has found that it helps. You know, the first one up there, boosts that immune system and then increases the levels of cancer-fighting cells. And not to mention, down the line here somewhere is, it also makes your skin feel better too, or look better. So keep that in mind too. So what we're going to do is we're going to do that right now, okay? That's what we need to do. I need everybody, I know this is going to feel awkward. I know, come on, up, out of your seats, please. Out of your seats. I want you to stand, and I want you to put your hands together. Please, everybody, stand up. Trust me, you've been sitting there way too long today. Anyway, all right, put your hands together like this, spreading your fingers apart, okay? And then what we're going to do is, as you do that, we're going to clap, which will activate the acupressure points from there into your body. So do it this way and go, and we're going to go ho, ho, ha, 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 ho, ho, ha, 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 and we're going to do it 3 times. And then after that, I want you to throw your arms up, and I want everybody in the lobby to hear you go, yay! Okay, all right. You can do this with me, I know. All right, so all together. Ho, ho, ha, ha, ha. Ho, ho, ha, ha, ha. Ho, ho, ha, ha, ha. Yay, yay. Okay, don't sit down. Nope, I'm not done with you. No. Because while you were clapping, I don't think you noticed, but all under your seats and under the tables and up and down the aisles, I planted a whole bunch of long stem daisies. Look down, look around, you'll see them. So what I want you to do is I want you to bend over and I want you to pick a daisy or a bunch, it doesn't matter. You'll notice I did make them long stem, you don't have to bend over too far. So bend over, pick those daisies up, and I want you to take a really good look at that daisy or the mini daisies. Now, hold it up there and I want you to look at it and smell it first. Smell the nature out there. Okay, now I want you to take a look at that daisy. I know for me, when I look at that daisy, it brings a smile to my heart. It really does. I hope it does all of yours, and if it doesn't, I don't want to know. But I want you to look at that daisy, and then I want you to start laughing. Oh, and before there is a secret about this, by the way. You see your body doesn't know the difference between fake laughter and real laughter. Either way, you're going to get all of those benefits. So, we're going to start laughing, and I know it's going to be fake, but I guarantee you, it'll turn into real laughter. Okay, so look at that daisy and okay, you can stop because we just can't do this all day. But by the way, in case you read all these benefits, if you were to do this for 10 minutes, it's the same as being on a rowing machine for 30 minutes. Just saying. So think about that. But here's the key to this too, is that research and the studies have shown, and you can sit down, I promise, I won't bother you too much more. Research has shown that this laughter and playing, by the way, are all beneficial to your health and your physical, mental, and emotional health. Laugh as often and play as often as you possibly can. So now, let's talk now about supporting the cancer caregiver survivors. And as of today, I am going to coin this phrase, cancer caregiver survivors. Supporting the cancer caregiver survivors, I've put this quote up here from Dr. Applebaum because I think it's so important. Caregiver-focused distress screening programs have the potential to improve the quality of care for all those affected by cancer. So raise your hands. How many of you out there in your organizations, clinics, hospitals, whatever, how many of you give distress screening for new patients, new cancer patients, to find out where they are mentally and emotionally? Oh, fabulous. Oh, that's wonderful. I know, it helps. We used to do that as well. And to lead them to the right resources, it's just powerful. Now, my next question, how many of you give distress screening to the caregivers? Raise your hands. To the patient's caregivers. Still looking. Is there someone that I'm missing? Here's what. I became acutely aware of how important the caregivers to the patients are when I was working at the cancer clinic. And I was standing in the hallway, And I was talking to this woman, and she was telling me about all the treatments and everything that was going on. And I noticed out of the corner of my eye, her husband started to kind of go over and sit down on this long bench with against the wall. And then as we were still conversing, I was still noticing out of the corner of my eye, and his head started to come down, and his shoulders started to come down a little bit. And I said, Margaret, can you just wait? Hold on. Excuse me, just one moment. And I walked over in front of him, and I said, hey, Dan, how are you doing? And this man very slowly raised his head, and he had tears welling up in his eyes. And he said, you know, you're the first person who's ever asked me that. I was devastated. I knew right then and there we were not doing the right job. We were falling on our face because it is imperative to pay attention to the patient's caregiver, to their mental and emotional health, because it will impact your patient's physical, mental, and emotional health. It is imperative. So what I would suggest a couple of things is if the caregiver is there and they come into the exam room with the patient, pay attention to their body language. Pay attention. It's huge. The other thing, I mean, if it seems appropriate, and if you think you need more information, take that caregiver aside and talk to them alone, because I'll guarantee you that caregiver knows more about that patient than that patient is telling you. It is huge. And you know, the next day after I had this opportunity to talk to this gentleman and his wife, I started some brand new programs that were totally for the caregivers. It is huge how that impacts your patient's health. Please pay attention. Now, there are other things out there, lots of resources. You all know NCI, and of course, they always have some great information about caregivers, and also another one that I recommend is CDC. And I know probably in your own clinics, hospitals, or wherever you are, you probably have some therapists. You know, if those caregivers, there's, you know, cognitive behavior therapy, there's problem-solving behavior out there, therapies to help them get the resources for them. And please, excuse me, do not forget your local nonprofits, because they're there to help you, help your patients and the caregivers, I'm sure, because more and more are doing that now. They're there to help you. And speaking of which, okay, is Sights and Insights, and we are an international nonprofit, by the way. And this is what I call the SAI method, because what we do is we have what I call mindful therapeutics through art. But we use art as the conduit. But what's behind it is this is just some of the things that's integrated into what we do in all of our programs, whether they are classes, workshops, retreats. And also, by the way, this next year, I'm going to be having our first clinical caregivers retreat. So if there's anybody out there who knows your hospital, clinic, or whatever, who would like to partner or support us, please let me know. Now, I'm full disclosure here. I just recently have been diagnosed with metastatic bone cancer, and starting this month, I'm going to be taking full advantage of my own programs. But now here's what I do know, and I can tell you for sure. You see, today, I have more tools in my back pocket than I did 16 years ago. So you're never alone with Sights and Insights, and what we tell people whenever they come to as a participant the first time in a class or program, whatever it is, the first time, if you're a supporter, if you're a donor, whatever it is that you are, if you have anything to do with Sights and Insights, we inform you that you're now a part of the Sights and Insights, or what I call the SAI family. Like it or not, this is your new family. So I will say to you today, welcome to the SAI family, because we are stronger together. That is for sure. I want to thank you so much for being here. Safe travels, and I hope that I have been able to give you maybe a different perspective on caring for others and caring for yourself, and maybe even a few new tools along the way as well. So I hope you enjoyed it, and if you have any questions, I'm here. So thank you for being here. Safe travels, everybody.